Glad to have you with us tonight at 6 o'clock, everyone. I'm Bob Clausen. Little Rock playing host to a member of the White House coronavirus task force today, Dr. Deborah Birx. She led a roundtable discussion with state leaders and health officials about the state's response to the coronavirus. They covered a lot of topics. Jay Burr was there. He's joining us now with more, or at least a portion of what was talked about, because they spent some time, Jay.
Yeah, absolutely, Bob. In fact, Deborah Birx has been making her way across the country on this sort of tour that she's taking here, Arkansas being the 19th stop today. And what she says, she wants to really emphasize that she wants to hear feedback on those White House guidelines that have been issued. And she also wants to hear states' plans for battling COVID-19. White House Coronavirus Response Coordinator Dr. Deborah Birx believes that Arkansas is beginning to show improvement.
We're beginning to see that improvement because we think that the people of Arkansas are following the important common sense path forward to get control of this virus.
Much like Governor Hutchinson has said, Dr. Birx thinks the White House is not seeing spread from restrictions that have been lifted in states.
We're finding that the majority of community spread right now is happening from parties. Everyone believes that there's no one there that has COVID, and yet there is someone there who has the virus.
Arkansas is only a week away from starting school, and Dr. Birx says she likes how the state has given guidance to districts in order for them to tailor their response plans specifically.
We also have to have the parents and the adults in the communities making good judgments of how they prevent community spread in their communities so that children don't go to school already infected because of what has happened in their community.
Dr. Birx says it's been tough for governors across the nation to enforce policies to help stop the spread, a big reason why she is out on the ground.
It can't just be a one-way where I send out recommendations and policies and I don't hear back from the reality on the ground and what people are actually seeing. Asking people to change behavior, you have to meet them where they are. And so I've tried to really carry the message of this is what we know works and this is what we know will stop the cases of the virus.
Now, Dr. Birx says she really likes Arkansas's surge plan for testing, and in terms of the federal government, she says the White House coronavirus task force has been working with some of those national labs in order to get supplies going and also to try to work with them to bring those turnaround times down. She said they've been successful with that recently, but they still would like quicker turnaround times, at least on the national level. Also, too, she did say that the government is starting to look into other methods of testing. Is obviously with that PCR test, you get way up in the nose, and she said people just don't like it, and that could be a deterrent. They said that the federal government is starting to maybe roll out a saliva test, possibly come September. Live in Little Rock, Jay Burr, KRK 4 News.